Hey guys, it's Charles and welcome to Good Clinical, a podcast and YouTube channel dedicated to showcasing the future of medicine and human health. On today's episode, we have Dr. Maddie White, a translational scientist and the Strategic Partnerships Manager at Gillies-McIndoe Institute. Welcome to Good Clinical, Maddie.
Hiya.
So translational scientist, before we got rolling, literally 30 seconds ago, you mentioned that someone said to you, do you just translate other people's research? But no, translational scientists are a little bit more involved than that. What do we need to know to understand what a translational scientist is?
Cool. Excellent place to start. I guess a translational scientist is just someone who is moving research from the lab, or I guess wherever that research was created in an academic environment, and into real world, so creating real world impact from the research, whether that's commercial or grant funded, it doesn't really matter, just translating that research.
Yeah, I always say that good ideas are only good if they can be applied in the real world. It's no good if they sit on the shelf of some prestigious academic institution and someone toys with it every now and then. It needs to have real world impact. Otherwise, it's just an idea. It's not really a thing. So the translational aspect is bringing it from the bench top to a commercially viable product or service, or is that kind of the...
It's kind of the in-between, right? So pretty much everything that happens in the in-between would be the translation of the science. So the academic ideas or the research that's typically grant-funded is the beginning of it, and then translating it is where you start to move it down a commercial path into something that's viable or something that can be picked up or licensed, whatever that is. And then the product, I guess, would be the end bit that I guess I don't have much input into that side of things. Yeah,
that's for the business boffins to worry about.
Yeah, pretty much.
Sell,
and stick to what I know.
Nice. So what got you interested in this? Because you've done a PhD, you spent some time overseas as well. So yeah, what got you into the idea of becoming a translational scientist?
Well, I guess that's the thing that you always try to find out when you're studying, right? What is it that makes me, and what, makes you want to do the things that you do? And for me, my research had always focused on quite real-world impact, but I didn't really know how to move that research into something that was, I guess, going to actually have the impact that I was always saying it had when I did a presentation. My cool science means you can do this, but I didn't really know what the next steps would be. And so when I was in my postdoc at the University of Glasgow, this job came up, and it was called a translational scientist. And I was like, sounds great. What does that do? And it was working in the tech transfer office. And then I was like, typical academic, what is that? Which is embarrassing now, because I think I would love more people to know what commercialization and such is. But I really wanted to know more about this job. It had industry collaborations, the NHS collaborations. This was in Scotland, so NHS healthcare services, and those are like pillars of collaboration. I was like, that sounds really interesting. I want to know more about that. I was on maternity leave, so at that point I was like, all right, we'll just apply for the job, see what happens, write a cover letter, midnight, whenever it was, an interview for this job. And it just fit me to a T in a way that academia was never going to.
Right.
So just being able to create impact from research I was like, yes, sign me up.
Yeah, nice. Yeah, because I think there's probably two types of, there's not just two types of people, but broadly speaking, two types of people that get into the sciences. One are those that just love it. They love unearthing the next, discovery, or shedding light on some kind of crazy molecular pathway and adding another cytokine to the list of millions of cytokines that are probably out there. But there are other people that want to take that into a real world setting. So it requires science is quite rigid, but I imagine translational science, there's a bit more creativity involved, there's more collaboration involved, there's less nitty gritty. It's more like bringing people together to create something from an idea on a bench top, more or less. Would that be fair to say?
Yeah, absolutely. Yeah. I think I found I didn't want to be an academic. And actually almost everyone along my academic path had aspects of entrepreneurial or innovation. There were patents, there were startup companies, and yet somehow I was still really ignorant to that. I was still very I don't want to be an academic. I don't see where I can go. For whatever reason, I just didn't realize that there was this other path until I found this job. And yeah, I just always knew that I guess my skill set, my worth, and my values around the type of research or the type of jobs I wanted to get involved with were just not the academic track. I didn't really have that one topic I loved and wanted to write all my grants and find that pathway or that cytokine or whatever it is. Like some people just do, and they're driven in that way.
Sure.
And totally respect that, and those people are needed, and Blue Skies research is still needed. But I do think there's just this whole other hat that people can have. And that's where I found my thing. My hat was bringing in that network, bringing in that knowledge, bringing people together, and understanding the processes and the strategy of like bringing a product to market, that kind of thing. And when I found that job, I did this amazing course on research commercialization out of Cambridge online. And it was this 8-week course, and you learn all about tech transfer. For me, it was just like, I was hooked. I was like, sign me up for more of this, spanning that sort of business world. And it's just a language difference as well. I think academics are a little scared of commercialization, and the language, the businessy language that's involved in it. And I guess the money, you're just selling your idea for money, that aspect. But yeah, no,
I find the academics or healthcare practitioners a little bit they're nervous around the money side of things. I was away for business recently, and I was talking to this medical oncologist who's based out of Nebraska of all places, and he's world renowned and being a really great recruiter to clinical trials. And I was talking with him, and it was really interesting how completely comfortable he was with talking about the money side of things. But he was saying that the money, I bring in money, but I use that money for a greater good, and I use that money to be able to provide services, subsidized services to the community. So he works in clinical trials. He charges a huge amount of money for a patient to be on the clinical trial, and then he uses the proceeds from that clinical trial to subsidize healthcare for people in his local area. But he wears a flash suit. He's got nice things, and yet he's completely comfortable. And he's probably a bit of like a meme version of someone that's comfortable with the money. But it really struck me as like, it's not like it's kind of viewed as like a corrupting factor, money, but it's just how it is. Like, money is necessary. You need money to do great things. Like, why are we shying away from it? Why do we have this image of like, the poor academic is so noble?
People are genuinely driven by money, or at least driven in some way by their living a comfortable life, sure. Right? So, yeah. Have you ever heard the saying, quite often in your PhD, what do you want to do after? And people go, is it academia, or are you going to sell your soul to industry? Yeah, and it's the same, like, are you going to go to the dark side? As if, and I think that's the beginning of it, isn't it? Where they just brainwash you to think that somehow you're, by commercializing something and making money off your lab idea, you're, I don't know, not a great person, or that's not particularly great. But I guess what you have to realize is that some element of money changing hands is how ideas really come to market. And it can create a revenue stream for your academic research if you wanted to stay in academia as well. So that happens quite frequently, where if you license something, then you're creating a revenue stream for your lab group, for example.
Yeah, definitely.
And fund your own research. Great.
Exactly.
Yeah.
And not have to write endless grants to get $50,000 out of
Exactly.
Yeah. So I think it requires a bit of like a frame shift, right? And I think maybe Kiwis are more humble than average, and more, it's the dark side, than the status quo. And I think maybe we're slower on the uptake, and maybe it's changing, but we have to be more comfortable with that, because there are alternatives to fund Blue Skies research that are to just waiting for the government to release the next round of funding, which is dwindling every year. So, that's interesting. So what kind of projects were you involved at the Tech Transfer Office out of Glasgow?
I had this amazing project working on RNA biomarkers for cervical disease. So if you know about HPV infection, cervical cancer, so understanding how abnormal changes in the cervix with HPV infection can sometimes lead to cancer, and sometimes things go back to normal. Right. And creating a sort of biomarker test to change the way healthcare is done, so that the ones that would likely progress to cancer are the ones that are treated, as opposed to all abnormal changes being treated, which obviously affects fertility.
Yes.
So that was kind of
Amazing.
the crux of the project. So I had a great collaboration with the NHS and with my supervisor. But what was quite funny is that I interviewed for that role with the tech transfer office and with the academic that was leading that sort of tech transfer office, but not the actual supervisor who was doing the project. So once I came off maternity leave and started my project, I actually met the lab and the supervisor that I was going to work with, and they were so lovely. But I went into a job where I didn't actually know where I was going. But I was there for the ride, right?
Yeah. You're like, that's me, I think. Let's find out.
I'll sign up.
Yeah. That's fantastic. So where did that project go in the end?
Out of my sort of 9 months that I ended up working on that project, which was the length of the project, but also I moved back to New Zealand at that point. So I luckily timed that just right. But they managed to get the next round of funding externally to progress that. That's
excellent. Yeah, because it is, it's not like you get one round of funding and you can take it all the way to the end. You know, it's series of.
Yeah, absolutely. And I think the cool initiative for the university was creating a scientist that could dip in and out of different projects. So there were a few other projects that I got involved with, as well as the grant funding. So they held internal translational funding to sort of progress projects to a point of commercialization. So I got to kind of have eyes on all of that as well, which meant I just massive professional personal growth as well, which is just a really cool.
Because obviously you're not the key opinion leader or the subject matter expert for HPV biomarkers, but you don't need to be, because you've got the academics that they are that. And so what was your role on a day-to-day basis? Is it just like drawing in their expertise, plans for the project, funding, partners?
Yeah, it was kind of a bit of everything. That project was quite sciencey, so I was in the lab doing a whole lot of PCR screening of different genes that they had found were interesting, some preliminary stuff. So a bit of that, and then a bit of understanding the IP positioning, and then getting that expertise on board once things had progressed to a certain point, and deciding at what point things could be protected as well. So
So the IP side of things must have been quite interesting, because when I did my master's degree, we did a whole course on IP, and that was just like a complete, frame shift for me, because when you come from a science background, you kind of think everything is so noble, and you don't need to, have rigorous protections around a concept or an idea, and then you don't need money because money's evil, But the IP thing I found it so fascinating, and you hear of these people that are, like IP trolls that, do aggressive ring fencing of their ideas by countless patents to protect it. But that must have been an interesting learning period for you as well.
It was enlightening, and figuring out things like prior art and like at what point you need to be engaging and thinking about protecting the ideas and presenting your research at quite like low level little symposiums can actually count as prior art and that kind of thing. And I think like it's just as an academic you're like, oh, what? So now I can't talk about my so I'm like gene A. So just those kinds of things.
Completely vague.
And I had someone come up to me today after a talk that I gave and was telling me about her amazing sort of bit of software technology that she was kind of working on. And she's like, I really want to publish so then I can get recognized for my work. And then, people will want to partner with me. Maybe there'll be something we can develop in the future. And I said, okay, but maybe the other way around. So I was like, maybe get some professional advice around like whether you need to patent your idea or trade secrets, sort of keep your ideas hidden for a little bit longer and build those relationships first before you publish something, because you might ruin it for yourself.
Totally. Yeah. Just blown up any chance of having something protected. Yeah, which is it's quite interesting how there's probably two mindsets towards IP protection. One is that it's a necessary thing to incentivize innovation and investment in very expensive things. Another one is that it just hinders collaboration because you've got everything tied up behind this, wall of patents. But I can see both sides, but it's definitely a necessary thing to have. Otherwise, if you don't have absolute control over the commercial prospect of your technology, why would you spend time and money and effort building it? So I get it.
Yeah, absolutely. It's like a juggling balance, isn't it? But just thinking about it and having it front of mind for commercial stuff, it's definitely worth at least thinking about beforehand, whether you act on it or not, right? Just getting the advice.
Totally. So you and your family relocated from Glasgow back to New Zealand. Obviously, you're originally from New Zealand. You came back to. What prompted that? I mean, why would you come back to this beautiful nation of ours?
Oh, this beautiful nation. You know, what's actually quite interesting is how much I really was loving my new space that I found with work. And it was like I found my purpose and I could see myself carving out a cool space. So I was pretty happy, but it turns out my husband was not happy with his job. And so much so that he basically turned to me one day and goes, yeah, I quit. And I've got a 3-month notice period. Yeah, and I was like, oh, that's cool. So home then? Yeah. I mean, at this point, we had talked about moving home before the kids started school, and everyone's based in Wellington pretty much for our immediate family. So raising the kids around family is something we wanted to do. We had made a bit of a family back in Scotland, so tough. But yeah, it just kind of became, now's the time. So we had to up sticks and sell our flat, network our way into new jobs, and buy a house. We bought a house while we were still in Scotland, but through family.
Well done.
Yeah.
Jeepers. And this was like partway through the pandemic, right? I mean,
I guess it was the tail end. So this is 2022.
Yeah.
So,
that's still, yeah.
Well, yeah.
Gosh.
Pandemic.
Well done. And what was when you returned, and you'd obviously had all the experience working in a tech transfer office, what was that like? Were you pleasantly surprised at the opportunities here in New Zealand, or was it a bit of a, oh, okay?
Both.
Okay.
So I kind of felt like a bit of a baby when it came to tech transfer, right? Like I had been in as a scientist more than anything for about 10 months in that role. So yeah, minimal experience in a way, but a really great course behind me. So I kind of had the fundamentals of understanding. The other thing is that the UK and Glasgow have, I guess, a different funding strategy. So being a scientist in a tech transfer office doesn't exist in a lot of places. It's quite unique even to Glasgow, maybe the Crick Institute. But yeah, so there's just that kind of role didn't exist here. My experience was pretty minimal, and turns out everyone was going quite lean at that point in time. And so I found it a real challenge to find a job. Obviously, your network is your net worth.
Favorite phrase of all time.
Such a great phrase. And I just did my best to network. So using LinkedIn as a powerful tool. I mean, it's a powerful tool for little scientist introverts. So I just did a whole lot of that. And I had so many conversations with different people, which was, 10 p.m. UK time so that I could fit in with Kiwi business hours to try figure out what it was in this space that I could bring my knowledge and try to find a job to pay my mortgage. Yeah, that flipping mortgage. It's always looming in the back of my brain too. So you obviously had your 3 months to kind of like lay the groundwork. 4 months. He took 6 weeks or so off to organize the house. Oh yeah, as you do. Yeah, as you do. House husband. Yeah. Must be nice. Yeah. Oh, very good. Yeah. So, but what I've been quite inspired by with all these conversations on this podcast is actually despite how little we talk about what's going on in New Zealand, there's actually a lot going on in terms of taking ideas from universities and pushing them through the translational matrix and out to find a commercial product. It's really, really cool. So you found your feet at Gillies-McIndoe, and that your current role, it's not translational sciences, but strategic partnership manager. Yeah. Which is more or less translational science, or it's kind of a role we created. We didn't want to use anything that sounded too commercial for a charity. Being a research institute, we're a charity. I actually hold both my titles. So I came in as a senior research fellow, and that's what I put on research grants.
Yeah.
And then when I'm talking to people more in the business world to understand like my skill set and my worth, then I put strategic partnerships manager,
Nice.
which means that I get to just help build collaborative networks for the Institute, use a commercial hat. And it just kind of gives me that space to kind of do the things that I'm interested in doing and network with the people that I want to network. So it's kind of a cool role. And the project that I came in for was very translational scientist position. Like I couldn't pass it up because I don't know anyone else who had that kind of skill set.
Yeah.
It was very similar to the stuff I was doing in Glasgow. It just wasn't called a translational science. I mean, it wasn't really called anything, but because I sort of found it without, it was an advertised role.
Yeah.
But yeah, it's very much scientist with like commercial milestones built into a project that is patented and is going to market with AFT Pharmaceuticals. So it's it's a very translational project.
Yeah.
So yeah, I was like, all right, sign me up for that one.
Yeah.
And I just saw an opening and an opportunity to also build things around that. So I was doing the lab work and then also trying to, this is very challenging though, doing lab work at the same time as trying to have like lots of different meetings with different people is really hard because you're like, my cells are reading now and I have 5 meetings lined up and I'm going to be off site or something. So it is a challenge, but.
Yeah, true. Gosh, you're like juggle both things. Like you said, the timing is everything when it comes to scientific experiments. You can't be like, I'll get back to that in 4 hours. That's fine. Oh, the call went over by a couple of hours and I got to go now. I'll do it tomorrow. No, it's like right now.
Especially when you're juggling like lab bookings and stuff. So at that point, when I was doing some of my work, we had a whole bunch of new students in the institute. So we, there's only so much lab space you have for certain pieces of equipment. So I was like, can I have it, please, so I can go pick up my child from daycare?
Yeah, so you got your lab to worry about, your commercial partners to worry about, your child to worry about, and the other lab, people using the lab as well.
Yeah, I know, and they were all really accommodating, young students who don't have kids. So, but no, like just really lovely that they could do that.
What are you allowed to share about the project with AFT?
I can tell you a little bit about it if you want it.
Yeah.
There'll be some things I'll not
Totally.
share.
We can't infringe on any patents or any commercially sensitive information. Yeah, go on.
The crux of it is that it builds on a whole lot of research that the founder of the Institute, Dr. Sweetan, has done a whole lot of research on vascular birthmarks. So the strawberry birthmarks appear on children, I guess, within a few days of birth. And they just proliferate. They just grow into these tumors. They can be really cute and small, like on the head and not bother anyone. Yeah. Or they could be in the eye and quite large or just under the skin on the neck. And they can be really detrimental, really kind of invasive and nasty. And they go through this growth phase and then naturally regress, which is quite interesting. But for a lot of them, you need some sort of intervention if they are too big. And they also can form a bit of a scar if they're left to heal on their own. So the current treatment for them is beta blockers. So so like adult hypertension medication. And that was like a serendipitous finding.
Okay.
And even that, people don't really know exactly how it works. So it's a very interesting area of research, and I generated a bunch of more academic questions around this.
Sure.
But the idea of the project is coming up with a topical cream to be able to treat some of those babies away from like a hospital setting and lower risk profile, obviously.
Wow. So the serendipitous finding, was that just in patients that had strawberry birthmarks as adults, were taking beta blockers for whatever reason?
So as babies, but they had to take beta blockers for their underlying conditions. Yeah. It's crazy. It's so crazy.
So they had some kind of heart defect and also serendipitously had
and
strawberry
then they
birthmarks, and they noticed it throughout the course of their treatment. Wow. And so the mechanism of action of why the beta blocker reduces the size or vascularity, or? I
think there are maybe more than one mechanism that goes on. So they don't 100% know. There are other beta blockers that have been used successfully, and within the pathway, like an ACE inhibitor, and some of that has some of the effect, but maybe not all of it. So the crux of the project is combining 2 repurposed drugs. See what I did there? To create a more effective topical treatment.
How very AFT Pharmaceuticals that is.
So partnering with AFT Pharmaceuticals for that project, which has been amazing. And then we do, I guess, our tech transfers through Massey Ventures, but particularly Sean Mackay is the one that like masterminded the whole project and brought me in. Yeah.
Excellent. Okay, so 2, are they both beta blockers? Sorry, one is a beta.
Oh, I'm not telling you.
Okay, fair enough.
Oh, no,
Fine.
they're not both beta blockers, but I'm not telling you.
So 2 drugs that work in synchronicity in a topical formulation. Is it the goal to stop the growth, or is it to reduce the size and the vascularity of the strawberry birthmark? Okay,
to help it regress. So if you intervene quite early, then you're more likely to slow down that growth and not have such a big tumor anyway, and less scarring is the idea. But obviously, I'm still at that little science end, and there's a bit more that needs to be done. Yeah,
sure. So how does setting up a project in a partnership like this works? Obviously, you from the Gillies-McIndoe perspective, are you reaching out to the Massey Ventures to say, look, this is something that we've got in the pipeline. We would like to spin this out, commercially partner, and then they go out and find a viable commercial partner? Or is it a...
Yes and no. I mean, this particular collaborative network, so Sean Mackay actually did do work with Gillies-McIndoe throughout his studies, I think, and has that prior relationship. So it's kind of his conversations and networking for the pharmaceutical partnering that all happened, I guess, prior to when I started.
Yeah.
But the good thing is that we've built such a great partnership with lots of trust now that we are progressing another topical treatment. Yes, for keloid scars this time using
That's incredible. So exactly what you're saying, you got these commercial partnerships which will help fund the next academic research that could then also become another revenue stream, and then we just keep on going until perpetuity.
Yeah, I mean, I'd like to think that everything is going to be successful, but you've got to have some level of understanding around the risks. And, things aren't always going to go directly to market, but if something did, I guess the royalties on what you have can help fuel better equipment, better science, better research. Yeah. And what I'm most interested in is better talent, right? Like keeping our scientific talent in good science jobs. Yep. Yeah, and particularly beyond academia.
Yeah, because that's a fantastic pivot to the 3 main ingredients that everyone that I talk to on this podcast say that we need, and one is talent, the other is infrastructure, and the other is money. So those 3, without those, you can have 2 of them, and it's not going to work. Because you can have all the infrastructure and all the money you want, but if no one's going to do it, then sorry, all the people you have and all the infrastructure, but no money to pay them, not going to happen.
Not going to happen.
It's not like choose 2. And you're away, but you need 3. Yeah. But yeah, so I mean, it depends on who you talk to, but the human capital side of things is a real. I think it's top and it's front and center. It's the most pressing issue. It's like even if we have a little bit of money and a little bit of infrastructure, we just don't have enough people. Educated, qualified, technically minded with a commercial brain as well to make money out of these things.
Yeah, but do you think we could?
Yeah. I think we could. If we had more awareness or more education about opportunities. I remember I did my master's degree. I finished it 10 years ago. God, that's kind of sad to say out loud. Well. But I did a flippin' master's degree in commercialization, and I had no idea when I came out of that, what I was going to do, because there were a few people doing it, but there wasn't that many. But now there's so much more. So there's a huge opportunity to really present the options to people that are doing a BSc, or maybe they don't know what they want to do. They're going to do an honours, or okay, I'll do a PhD, fine.
Which is kind of what I did.
Yeah, I mean, there are alternatives,
way,
right? There are alternatives to people that have an interest in science that don't want to be an academic or a bench.
Yeah, it's just lack of awareness, isn't it? I think there's talent, such amazing, brilliant minds already coming out of our universities, and the thing that I came across was I have a PhD, but so what? When you come to because I was thinking I'm definitely not going to be like an academic in that way. But I didn't see any other opportunity for me. And again, this is like 9 years ago when I finished my PhD. So it's not, it's about creating pathways and then creating like visual around that pathway for the students. And I've had some great students come through the Institute just touring around, and I've been telling them about these different paths, and they genuinely don't have any idea. And these are people that even are doing biotech degrees and stuff with academics who are more commercially focused. It's just not quite spelt out enough yet.
No, that's right. And it's the classic thing of if you're not aware of something, you're not going to pursue it. If something isn't visually, there's no visual cues or suggestions to it, like why would you even like ask questions or find out more about it? If all you do is you're super diligent, Bachelor of Science student at your lectures and at your labs, that's like kind of what your range of thinking is, But if you see all the other awesome things that you can do, then you might pursue it. What do you think about the other two ingredients that we need? What are your thoughts on the infrastructure and the capital?
Infrastructure-wise, I guess there's a fair amount of siloed infrastructure, right? So it's about maybe bringing things together and putting it into a translational research institute that doesn't exist maybe necessarily in the physical form, that you've created a new space and a whole thing that sits under one umbrella, but bringing everyone together. Like some parts are already happening. MedTech are kind of creating these little hubs, I guess, or across the country where that's already happening, and sort of creating a space where you can have translational scientists who already know that they're not the academic people, but can you employ a group of them and do what I was doing, where you're kind of being dropped into these different projects and you train them up to have commercial knowledge, and they can move in and out of startups, for example, and they have that experience and expertise, the talent to build it. So I think infrastructure-wise, there's already a lot of great places. Everyone's kind of doing their things, but maybe a little bit too siloed. And money, I don't even want to go there with money, because government has changed so much this year that for sure. But I would like to see blue skies research still existing, but innovative pathways being created for PhD students, and putting some money into that side of things, because I felt pressure to go overseas for my postdoc. And when I went overseas, I didn't feel like there was much of an industry here anyway, so I was keen to sell my soul to industry, whatever that meant. So I think that's changed, but keeping the information up to date for the current students.
Yeah, definitely. Because I kind of feel as though, have you seen it's a bit of a meme, and it's like good times create hard times create strong men create good times create weak men create hard times, and it's like kind of this little circular logic, and it's the meme I saw. I've said meme like 3 times in this one episode.
It's really
I don't see that. I don't go hunting up memes, but anyway, this one I did see, and it kind of illustrates that, like, even when times are good, you kind of rest on your laurels, and you don't have to push quite so hard, and like there's enough of a safety net, and there's no incentive to really do the good hard work, right? So that's when they create the soft men who create the hard times, but the hard times create the strong men who create the good times. So it's like, although we're in like a bit of a situation where there's reduced funding, perhaps that will provide a bit of an incentive or an impetus to find alternatives and not wait for, the helicopter money to come through,
Yeah, that's true.
I would like to think that's a possibility, and maybe it's a rose-tinted way at looking at a bit of a negative scenario.
Yeah.
But maybe that's what's going to happen. It needs to come from the industry, as opposed to like, give me the money.
Yeah, it's an opportunity, and I guess when things are lean is when you really are targeted and direct and purposeful about the things you do. So yeah, there is definitely truth to that.
Yeah. But what would you like to see? What do you think would move the needle from your perspective in getting more people involved in translational science?
I guess it's creating pathways for people to move into those spaces. So translational scientist or maybe operations manager, but using those really talented minds that come out of the university, those people who have got their PhDs and they're ready and they're hungry and they're eager. I'd like to see some sort of investment into those people, but not in the traditional sense of here's a fellowship or something, but here's some upskilling you can do and, we'll help you get into this space. Or Callaghan do have some R&D, I guess, like career grants where they do a little bit of that already. I don't know who knows about it, and I don't know how much industry have the opportunity, because I think they have to forfeit some of the costs as well. Right. So it's that kind of thing. So cushioning that blow is something that I think would be really cool to see, to have more people.
Are there any courses out there that people can do from with a New Zealand focus? I mean, they could do that Cambridge online course that you did.
Oh, that was so good.
Yeah, and I know there's a few that US universities do as well, but there's nothing local, is there?
You're speaking my mind. Should we make that happen?
I think we should.
Okay, good.
Yeah, because we're going to need it.
Yeah, absolutely. I think if we did that, this would be the time. I think that's where our industry is at. It needs the talent to step up. And I think there's a lot of commercialization or the businessy side where they look at the PhDs, but they can't understand their value. So it's just kind of creating that, jumping that gap. So let's do that.
I mean, all the skills that you develop during your PhD, they're not exactly siloed for further academic research, right?
No.
Data analysis, you name it.
Yeah, project management, telling a story presentation. Yeah, exactly, all of that.
Well, Gene A
Planning.
is not much of a story.
Yeah, okay, that's cool. Exactly. So I think it's just the language is a big barrier maybe. So if you're in an academic setting and you do a PhD, you kind of are very primed and institutionalized for that one thing. And describing your skills and your worth and your value beyond that is sometimes simply just the fact that you don't know how to do the next role and apply for the next role and position your CV in that particular way. Yeah. Despite the fact that you're really awesome and driven and keen to earn no money. So
noble.
Yeah.
Yeah, it's quite interesting. I've never been a fan of being the subject matter expert myself. I've always known that, I might be able to rattle off a few facts and talk about the Krebs cycle if I really have to. But it's just not me. Some people are the SME and they just dine out on being the expert and just knowing everything. But I'm happy getting by with knowing enough so that I can influence more. If that makes sense. So it's if you have a certain volume, I'm shallow and wide, whereas some people are very narrow and deep.
And I'm the same, right? I'm more of I can know a lot about a range of different topics. And I used to think that was a weakness in a way. I never particularly enjoy going into the nitty gritty of one topic,
right?
Which is why I didn't think I could be academic in that way. But what our skill sets really do is allow the different disciplines to be able to talk to each other, because you can see each side and you can talk from each different side of that dynamic. So in a way, we're actually not more important, but just as important as the people who are the real subject matter experts.
That's right.
We just make it happen.
Yeah. It's just facilitating, right? I mean, I learned that as a project manager in clinical trials that, I didn't know, exactly how to, do the biostats or exactly the medical justification as to why we're designing the trial this way, but talk the language of the CRAs or the safety folks or pharmacovigilance, but it's being able to bring them all together in a coherent message to each other and to a client or the rest of the team. That is actually an under-celebrated skill, if I can say so myself.
Wow.
But yeah.
No, and I think you're absolutely right. And I think recognizing if that is your skill set, then you might struggle with a traditional path.
Yeah.
But that didn't mean you didn't work your butt off in your PhD or your master's or whatever, and that wasn't great research that you did. It's just that you bring so much value in a different way, and finding that space where that's celebrated is important. So I think it's good you've found it, and I've just found it. So
Only took me 10 years.
Yeah, me too.
Nice. Well, Maddie, this has been really, really interesting. I'm really looking forward to seeing the outcome of these two partnerships out of Gillies-McIndoe that you're doing. and also obviously all your other endeavours. Where can people go if they want to find out a bit more about you or those projects?
Wicked. LinkedIn. Always LinkedIn. Connect on LinkedIn.
LinkedIn.
Yeah.
Love it.
There we go.
Awesome. Thank you.
Cool. Thank you.